All right. So we're gonna talk about some issues that have come up in the news that are really popular topics with people in the gross room right now, and I'm interested
Sure.
in as well. You talked
Yeah.
about some of them in your book and maybe not all of them, but first we'll talk about incels. You did talk about that in the book. And I've been hearing a lot of Bryan Kohberger case of the guy that is accused of killing those Idaho students.
Yeah.
I Have you heard about that case?
Yeah, I know a bit
I'm
about
sure
it.
you
Yeah, yeah,
have.
yeah, yeah, yeah.
So a lot of different experts that have been interviewed on the news and stuff have been saying that he is an incel. So can you explain to us exactly what that is?
Sure. Yeah. So incel stands for involuntary celibate, and it's basically a group of men who have grown recently on the internet through various forums who struggle to get sexual partners, but they blame society, and specifically they blame women because of that. So they feel that they are genetically disadvantaged because they're not as good looking as other men that they call chads, and that because they're not as good looking, they can't get the sexual partners that they're owed. And they also believe, this is their words, not mine, that most women intentionally go for men that are better looking from their level. So if every person, if all males and all females are kind of rated from 0 to 10 in terms of their looks, they believe that women of a higher status, sorry, of a lower status, will go for higher rating men. So basically, what all that means is that they feel that they're at a disadvantage. And I think probably the ideology, that kind of idea of basically being a frustrated virgin and not being able to do anything about it, has probably existed for decades. But the difference is now they've been able to get together and kind of egg each other on, and they have this entire philosophy. They have terminology, they have like the red pill and the blue pill. So it's almost like a cult, I would say. I mean, it's not quite a cult because they're not, physically living together, but their ideology is almost like a cult.
I feel that way. I say that often, that I think that I could pinpoint a lot of the problems that have been happening in the world are when the internet started. And you have these meeting. I feel like the shootings and stuff, it's like people have always had sick thoughts, but now you have these forums of, I just came across one on Reddit the other day of guys that they self-castrate themselves. And there's a whole
Wow.
entire group of people, it's like 12,000 members, that show pictures and upload ways how they inject ethanol and moonshine like into their testicles to self-castrate, and some of them just cut off their testicles themselves. And you're like, why are these rooms that all these people with these crazy thoughts are now able to be friends? And they're just hurting like themselves, but there's these ones that people hurt other people, and there's probably endless amounts of them on the internet, you know?
Yeah, that's a really scary thought, isn't it? I think probably what the internet has allowed is that people that have all these really dark and depraved kind of ideas, they have the courage and the platform to share them with other people. So if 20 years ago somebody who thought that, like incels do against women, if they thought that, if they thought of women as second class citizens and just basically were very misogynistic, if they said the wrong thing to the wrong person, they would get punched in the face, and rightly so. Whereas now they can just find a chat room where everybody thinks the same way as them, and it's like an echo chamber, I suppose, of just saying all these really sort of harmful, toxic things. And I think what we have to realize is not just words. Like our actions, our words have consequences. So you mentioned Bryan Kohberger. You might have heard of the case of Alec Manassian. So he is somebody who, I believe in 2018 in Toronto, he ran over 10 people and killed them. And he identified himself as incel. So he intentionally was looking for good looking women to ride over. And then even closer to home, there's a guy called Jake Davison who committed the first mass shooting in the UK in over a decade, and this was about 2-3 years ago. And he also had some very he had an ideology, he had like his own manifesto, he made loads of YouTube videos, and he identified with the incel movement as well. So I suppose what I'm saying is it's not just words. They're actually they can lead to very dangerous consequences.
So scary. All right. What about, you also spoke about this in your book, Postpartum Psychosis. So there was a case recently in the US. I don't know if you heard of Lindsey Clancy, her name was. She was
No.
seemingly normal appearing 32-year-old woman. She was a nurse, mother of 3, and her youngest baby was about 7 months old, and she strangled 3 of her kids with an exercise cord and then tried to jump out of the window to kill herself, but she survived. She's paralyzed, but she's still alive. And obviously at first I mean, as a mom, it's just shocking to hear something like that. But also at the same time, I've also joked, and you didn't mention this exactly in your book, but when you were talking about your kids and stuff, I used to joke to my friends all the time when my kids were younger and say, like, I understand why people drown their babies in a bathtub, because they just drive you nuts. And my 2 younger kids are only 18 months apart, and it was rough. And I love that you said that in the book, because it was hard when they were 2 and 3 and 3 and 4. It just was a hard time. But then obviously, like, I never really thought of hurting them like that. It's just like a joke I would make. And then when you hear this lady's history, it's so horrible. Like, she had postpartum psychosis, depression, was getting treated for it, and she seemed, from the patient's perspective, to be doing everything right. Her husband knew about it. They went to therapy together, and apparently she was on 13 different medications and I don't know exactly what they were. I'm sure you could look it up afterwards, but I was kind of a victim of the system, in that sense that I was put on lots of different like psych meds at some points, and then had serious issues with it, and not really able to follow up, and with it just affecting my life, my job, my family. And what is a patient supposed to do when they themselves have recognized that they have a problem, and then they go for the treatment and it's still failed them? I mean, this husband has lost his wife and his 3 kids.
Yeah.
And the investigators went to the house and said that it was so upsetting for them, because this was a mom who had like a playroom set up for her kids and pictures of their art on the wall. Like, it was clear that she was involved in their life and wanted to be their mom. And it's just so devastating that something like that happened.
Yeah. That's a really, really sad story. I hadn't actually heard of this lady, Lindsey Clancy. So I suppose it's a balance between providing good, thorough mental health care and being a bit too overbearing. So obviously a case like this is the worst case scenario. This is an absolute horror story, but there are thousands of women that have much milder issues after childbirth. So it could be a recurrence of a previous depression. It could be simply a temporary hormonal thing where mothers lose touch of reality for the first few weeks after childbirth. So you don't want to be over prescriptive, because you don't want to, you don't want to overburden a woman with loads of medication if she doesn't need it. So I think you indicated this yourself. If you have too many meds, then the side effects can make you quite drowsy. It can impinge on your functioning. It could even impinge on your ability to mother your baby. But at the same time, there are these kind of cases that you need to look out for. So even though it's exceptionally rare, you need to have a very good psychiatrist doing a decent risk assessment. So I can't speak to this particular woman, but I would be very interested to know whether a psychiatrist saw her. Well, I presume a psychiatrist did see her, whether they did a proper risk assessment. So did they ask the right questions? Did they elicit whether or not she had thoughts of harming her baby or her other children? And that is the biggest red flag for postnatal psychosis. So if you can find out that somebody has that, then your treatment plan completely changes. Either you have them completely supervised, so the husband is asked to stay at home, and this is a temporary thing, so it's not forever, it's for weeks or months maximum. Or you admit them onto a baby and mother unit where they've got nurses on standby, where they can be observed. So it's not a psychiatric ward with other patients, it's specifically made for exactly this situation. So it's kind of half maternity ward, half psychiatric ward, and I think that's the safest place for somebody that has these kind of thoughts. But you have to catch. The problem is that these cases are so exceptionally rare that the skill is in catching those cases where they are high risk. Once you actually identify the cases, the treatment is relatively straightforward. It's finding them out in the first place.
Yeah, it is scary, and you thankfully you don't hear about it often, but it's scary, and I don't know. I the thought of it scares you as a mom if you have no history of that, and then all of a sudden you start having these thoughts. It's just I can't imagine that you would feel really comfortable even saying it out loud. So
Yeah.
I think
Yeah,
that's why it's upsetting.
which is why you need a good psychiatrist that knows what they're doing. Obviously there is potentially a scenario where somebody absolutely refuses to disclose their thoughts, but I think if it's done in an empathetic way, most mothers, even if they're losing touch of reality, if they're asked in a sort of polite, friendly, non-confrontational, non-judgmental manner by a professional, they will probably admit if they have these kind of thoughts, which starts them on a process of being kept safe for that temporary period of time. But if you have a psychiatrist who doesn't know what they're doing, or doesn't have good communication skills, or simply doesn't think to ask the right questions, that's when you've got problems. That's when people slip through the gaps in the system, I think.